my name is Lacey Scully, and today I will be demonstrating how to do a blood transfusion. So the first thing I'm going to do is perform hand hygiene and verify my healthcare provider's orders. So here are my orders for my patient Samantha Lewis from Dr. Aldenine, and she has ordered us to transfuse 2 units of packed red blood cells, and then an hour after the transfusion has stopped to get an H&H drawn. And then I also have my sheet that was printed off that I need to bring to the lab to compare all of my information. So I'm just going to go ahead and verify that to my healthcare provider's orders. So I have Samantha Lewis, 6/10/1975. And then it also looks like she did have her labs drawn, and she is B positive and RH negative. So I'm going to take these 2 papers in with me, a consent form, and then an information sheet to educate my patient if she has any additional questions, and then also my flushes to ensure patency of the IV, alcohol prep, normal saline since I know it's the only solution that's compatible with blood products, and then my wide tubing. And I'm going to head into my patient's room. So I'm going to knock, provide privacy, and do hand hygiene. Hi Samantha, my name's Lacey. I'm going to be your student nurse today. Can I just have you go ahead and verify your name and date of birth for me? Samantha Lewis, 6/10/1975. Do you have any allergies? You do to codeine. Okay, that's what I have. So Samantha, I'm here to get you ready for your blood transfusion. I know the doctor was in here and talked to you about that. Have you had a blood transfusion before? You haven't. Okay. Do you have any questions? You don't. The doctor covered everything. Okay. So this sheet here is just an information sheet for you if you do think of a question. So it just kind of gives you some reading information about blood transfusions. And then it also goes over some signs and symptoms for you to monitor for if you were to have a reaction after the blood is starting to be transfused. So those things are back pain, fevers, chills, dizziness. So I'll be in here with you for the first 15 minutes, and I'll just need you to report any of those signs if they were to occur, okay? Okay. Do you have any more questions for me? No? Okay, so then this form here is just a consent. So I'll have you sign at this top part, just say I gave you and went over this information sheet with you, as well as signing here at the bottom, which is just consenting to the blood transfusion. So my patient has signed, so we are good to go to proceed in doing the blood transfusion. So then I'm just going to compare everything on here with what the band's on Samantha, just so I know everything's correct when comparing it in lab. Okay, so Samantha Lewis, 6/10/1975, 6/10/1975, and then your blood band ID is AFN 3899, and that matches. Okay, so I was just comparing everything so I make sure I have the right information, okay? Okay. So the next thing I'm going to do, Samantha, is just check your IV line to make sure it's still patent, okay? So looking at the IV, it's an 18 gauge, which I know is an appropriate size to run blood through. So I'm just going to clean it and ensure patency prior to getting the blood. Okay, you just let me know if you have any pain or anything, okay, Samantha? Okay, there's no edema at the site, no redness, and are you having any pain? No? Okay, so the site is patent, so I'm good to go ahead and get my infusion ready. So I'm just going to set up my tubing kit with my normal saline prior to getting the blood, so that way I'm not exceeding the 20-minute time limit after getting the blood from lab. First thing I'm going to do before that, I'm going to get vitals on Samantha to make sure everything is within normal limits, because if anything was abnormal, we would be able to give the blood transfusion. Okay, so after reading vitals, everything is within normal limits, so now I'm going to go ahead and set up my supplies. Okay. The tubing isn't expired or be tampered with. And then my normal saline. not expired, not tampered with. Okay, it's clear, not cloudy, there's no discoloration, there's no holes or leaks in the bag, so I know I'm good to go ahead and use this. Okay, so make sure all of my roller clamps are locked. Okay, and then I'm just going to use one of the spikes and spike my normal saline. Okay, I'm just going to prime this tubing. Squeeze this and fill it up about a quarter of the way. Okay. And then I'm going to take off this cap and make sure it's sterile so that way when I leave the room, I can put it back on the tubing. And then I'm just going to prime this line. Okay, and then since this cap didn't touch anything, I could put it back on. Okay, so everything's ready, vitals are good. So, okay, Samantha, I'm gonna go grab your blood so we can start your transfusion, okay? So I'm going to bring in the sheet that I verified all the information to the labs. That way I know I'm getting the correct blood for the correct patient. So I'm at lab. I'm gonna do hand hygiene, put on gloves since I will be handling blood products. And then I'm gonna verify all the information from my tag to the blood tag with the lab technician as my first check. Okay, so I'm here to pick up blood for my patient, Samantha Lewis. Okay, so I'll just have you verify all this information with me, okay? So patient Samantha Lewis, 6/10/1975 is the date of birth. Medical record number is PCS 78500. And the band ID number, the blood band ID number is AFN 3889. The patient is B positive, RH negative. Physician is Dr. Aldeline, room 222. Donor number is 120708. Donor is also B positive for blood type. Sample was drawn on 11/1/20. Cross match date 11/16/20, and it does not expire until 11/30/2020. And then it is compatible. Okay, so I verified everything with my lab technician, so I know that this blood is good to give to my patient. Make sure I have gloves on. I'm not going to shake the blood as I'm transporting it back to my patient's room. So I'm going to come back, knock, provide privacy, and then with the second nurse, verify all this information one more time for my second med check. So my second patient's in here, so the first thing we're going to do is just verify the patient ID band and date of birth. So Samantha, can I have you verify your name and date of birth for me one more time? Samantha Lewis, 6/10/1975. Perfect. Do you have any allergies? Codeine, and then blood band ID AFN 3889. So all my bands match to this, and now me and my second nurse are gonna start verifying these tags. So patient Samantha Lewis, date of birth 6/10/75, medical record number PCS 78500, blood band ID AFN 3889. Donor number is 120708. My patient is B positive blood type, physician Dr. Andeline, and then my donor is B positive blood type, and everything is compatible. So after completing my second med check, I can go ahead and get ready to administer my blood. Okay. So to do that, I'm going to close this and then do the same thing on this side with my blood, spiking it. Okay, so I'm going to squeeze this until it fills up halfway with the blood. Okay, and then just to make the infusion go a little faster, since I know it has to be infused within a certain time frame of 4 hours, I'm going to prime my line with the blood, but make sure that I don't lose any of the blood in priming it. So I'm just going to prime it until it is at the very end. So I'm just going to watch the blood as it travels through the tubing. Okay, so it is almost at the end, so I'm going to stop so I don't lose any. Okay, Samantha, so we're going to go ahead and get your transfusion started. Do you have any questions before we start? No? Okay, so just remember, once I start this, if you have any back pain, dizziness, fever, chills, anything like that, make sure you report those to me, okay? Okay, so then I'm going to set my IV pump to go between 25 and 50 mils. After my infusion starts, I'm going to get vitals to make sure there's not an increase or an abnormal change after the infusion started. So everything is still within normal limits for my patient. So I'll stay in the room with her for 15 minutes to monitor for any adverse reactions within that time frame. And then after the 15 minutes has passed, I'm going to get vitals again to see if there is a change. So after getting vitals, after the 15 minutes, there is still no abnormal changes. Everything is still within normal limits. So I know I'm good to go ahead and continue giving the blood infusion. So at this time, I can increase the rate of the blood transfusion. So we're going to set it to 125 mils per hour. So that way I know that this whole bag is infused within my 4-hour time frame. So again, I can now leave the room. I'm going to make sure to check on my patient every 15 to 30 minutes to continue to monitor for adverse reactions while my blood is transfusing. And then come back in. I would knock, perform hand hygiene, get new gloves. Hi Samantha, I'm just going to have you verify your name and date of birth for me one more time. Samantha Lewis, 6/10/1975. Okay, so your infusion is beeping, so it's all done. So I'm going to stop the pump, and then I'm going to close the blood, and then open the normal saline, and let this flush through to make sure that my patient gets all of my blood, all of her blood that is being transfused. I'm going to get her vitals one last time. Now the transfusion is done, to make sure that there wasn't any changes in her vitals from the previous times that I've taken it. And then I will disconnect her IV tubing. Okay, and so since this did have blood products in it, it needs to be disposed in a biohazard bag. So I would dispose of this in a biohazard bag and dispose it in the proper receptacle. And then make sure my patient doesn't need anything else. Her bed's in low position, she has her call light. And then I'm going to document how my patient tolerated the infusion, when it started, when it stopped, the infusion rate, the blood type of my patient, my donor, and also the unit number that was infused. And then I'm going to call lab and let them know that the infusion has stopped, what time it was completed. That way they can draw the H&H in 1 hour. So my patient doesn't need anything else. So I'll take off my gloves, perform hand hygiene, make sure to dispose of that in the correct receptacle, and then I'm done.